Symptoms are the body going right by Dr. Sparks, ND. This video is for educational purposes only and is not meant to replace your doctor's advice. Remember, some symptoms are emergent and require immediate medical care. As I've mentioned in my previous video, why do we get sick? We get sick when our physiology and biochemistry get out of balance due to unhealthy lifestyle choices. When we don't follow nature's laws, our body creates a toxic state of morbid matter and becomes a breeding ground for germs. This is called an unhealthy terrain. Then a symptom arises and alerts us to the cause of the problem. When you're exposed to others who carry a germ, the germ will enter your body, typically through the nose and mouth when it comes to cold and flu. If your body is well, there is no ground for the virus to grow and thrive in, and the immune system will win without creating symptoms. But if the body is run down due to improper food, drink, sleep, and stress, the virus will get the upper hand and go deeper into the body. After some time of viral replication and infiltration, more immune cells are recruited to come and join in the fight. These immune cells send out chemical messengers to create symptoms. Despite what we've been led to believe by years of marketing, symptoms are the body doing the right thing, not the wrong thing. Symptoms are not the enemy or something to be suppressed, as they are created by the body to help us and alert us to the problem. Imagine that the viral attack is like a fire on your stovetop. The smoke is like the messenger that turns on the alarm. Now imagine the fire department comes and uses a drug to merely turn off the alarm, but never puts the fire out. This fire is now free to grow and eventually will set off another alarm in the living room. Now the fire department brings another drug to turn off that alarm, and so on. In acute disease, the fire will eventually burn itself out or burn the house down, unless we use the symptoms as a roadmap to help ourselves heal. A fever is a good example of this. The chemicals go to the brain to increase the temperatures so the heat will help keep the germs at bay and the immune cell fighters can get the upper hand. When we take acetaminophen to stop this, the body loses valuable ground in the initial attack. You don't have a fever because you're deficient in Tylenol. Killing the germ inside the body does not eliminate the disease cause. The cause is not the germ, but the pre existing state of the organism, which permits the germ to exist and multiply there. Even the best antibiotic or antimicrobial herb will not kill all of the bacteria in the body. They kill just enough to give the body's immune response the upper hand in fighting the bacteria. The healthier the person is going into the illness, the better the chance of a positive outcome. For in the end, the body will fight the good fight, and it will win or it will die. If the body wins and is able to go through the illness naturally, it will actually be healthier on the other side. It will be able to recognize and fight off future infections more effectively. It will have rested and been nourished with fluids. What happens is that the body will sweat out toxins, have loose stools, a runny nose, or other symptoms that NDs call a discharge. This means that the toxic state that allowed the body to be a breeding ground for germs in the first place will be discharged by the symptoms, and the patient will have a healthier terrain after the infection and the body has fully recovered. So when you feel a symptom, think about what it's trying to tell you and how you can support your body's natural process. For a symptom is the body going right. Check out my next video, Fever is Your Friend. Thanks for watching, and as always, you can follow me on my blog, Instagram, Facebook, and YouTube at Dr. Sparks ND.